Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Idiopathic immune thrombocytopenic purpura, and in short it is known as the ITP. So the characteristics here is that there is a isolated thrombocytopenia. So there's isolated thrombocytopenia. So this is nothing but the presence of the antibody against the platelet membrane glycoprotein. So there is presence of the antibody, and this is against the platelet. So this is against the platelet membrane glycoprotein. It is against the platelet membrane glycoprotein, and the subsequent destruction in the reticuloendothelium system, and then there is a damage to the reticuloendothelial system, that is a RES. So this is one of the feature. Next will be the normal bone marrow. So they'll include the normal bone marrow, and that is it is normal, or it can be even increase in the number of the megakaryocytes. So there is increase in the number of the megakaryocytes. Next is the absence of the other causes of the thrombocytopenia. So there is absence of the other causes of the thrombocytopenia. Thrombocytopenia, other causes, they are absent. So now let's look at the focus on the types. So the ITP is divided into two types. One is the acute. So acute means it is less than 6 months. Then comes chronic. Chronic means it is greater than 6 months. So there is ITP. ITP stands for the Idiopathic Immune Thrombocytopenic Purpura. So under the acute, there is it has a peak incidence of 2 to 6 years. So this is the peak incidence. Then what about the sex predilation? So sex predilation is it has none. Then when you look at the antecedent infection, so antecedent, so in terms of the antecedent infection, so antecedent infection is going to be, it is common 1 to 3 weeks before. So it is going to be common, and this is 1 to 3 weeks before. Now what about the onset of bleeding? So the onset of bleed is it is going to be abrupt. So onset of bleed will be abrupt, and the platelet count, the PLT, will be less than 20,000. It is going to be less than 20,000 per microliter. Then comes the eosinophils by the lymphocytes. Eosinophilia and the lymphocytosis. So eosinophilia and lymphocytosis, this is going to be common. And what about the duration? Duration is going to be 2 to 6 weeks. Then what about the spontaneous remission? So spontaneous remission, this is be about 80% of the cases. So we just saw about the acute ITP. Now let's look at the chronic ITP. So in terms of the chronic ITP, the incidence, it is about 20 to 40 years of peak incidence. There is a PI, that is a peak incidence. Then what about the sex predilation? Sex predilation, it is female to male. If you look at female to male, it is about 3:1. Then comes a question on the antecedent infection. So antecedent. So in terms of the antecedent infection, it is usually, it's unusual. Whereas an acute, it was common 1 to 3 weeks before. Here it is going to be unusual. Next is the onset of bleeding. So when you look at the onset of the bleed, so the onset of bleeding is going to be insidious here. And when you look at the platelet count, So platelet count will be 30 to 80,000. So it is going to be 30 to 80,000 microliter. So the bleeding is going to be very insidious, whereas in terms of the acute it was abrupt. Now looking at the eosinophilia, so we look at the eosinophilia. So in terms of the eosinophilia as well as the lymphocytosis. So eosinophilia and the lymphocytosis. So here in terms of the acute it is common, whereas in terms of chronic it is going to be rare. And what is the duration? The duration is going to be in terms of months. Then question is on the spontaneous remission. The spontaneous remission is quite uncommon. So when you look at the duration, it is from months or it can even be years. Then when you look at the spontaneous remission, it is in acute it was 80% of the cases spontaneous remission, whereas in chronic ITP it is very uncommon. It is uncommon. To learn and grow daily like this, please do subscribe.